Okay, good morning, good afternoon, good evening, depending on when you're watching this video, and welcome back to Dr. John Ewer here at Ewer Specific Chiropractic. A common question that we get often in our office is, can chiropractors treat ear infections? And let me state right off the bat that chiropractors do not treat ear infections. But to answer that question fully, I want to take you down a little trail. So if you would, and remember, forward this video, like it, send it to people that you know that have children that struggle with ear infections. Let's talk about the anatomy very quickly. The ears have a drainage tube in them called the eustachian tube. That tube opens and closes depending on environmental factors. Whether you go up a mountain and your ears pop, but sometimes you have to squeeze your nose and pop your ears, or if you dive down and you go scuba diving, you have to equalize the pressure inside your head. That's the purpose of this tube, to protect the inner and the middle ear. That tube is controlled from the superior cervical plexus, which is made up of C1, C2, C3, and C4. So on my spine, it is right below the head. C1, C2, C3, C4, superior cervical plexus. That superior cervical plexus sends its nerve supply to a muscle called the tensor veli palatini muscle. The tensor veli palatini muscle is the only active opener of the eustachian tubes. Most times with kids with ear infections, whether it's unilateral, one side, or if it's bilateral, both sides, the eustachian tubes aren't working properly and they are stuck in the closed position, not allowing the middle ear to drain. What chiropractors do is simple. We have some different measuring devices that we use. We can use, depending on the size and age of the child, we can actually evaluate for upper cervical involvement in the spine. Right here we have two red bars at C2 and C3. If the child is very small, we use different instrumentation. This little dual probed instrument actually measures a temperature differential right at the base of the skull. This is how I've taken care of my own children for the past 2 decades. My kids have actually never had an ear infection, thank God. So if you need to have your child evaluated in the upper cervical area, know that we have instrumentation that can help us do that, and we make very gentle corrections to this area to help that child or that body just work better from the inside out with less drugs and hopefully less surgery. And again, this is Dr. John and Dr. Mario and Dawn and Kathy signing off once again here from Ewer Specific Chiropractic. Remember, please share and like this video. Visit our website at www.ewerspecific.com. That's EWER specific.com. Thanks once again.